Good morning. Welcome to TriHealth Table Talk. I'm Dr. Steve Cleves. I'm a primary care physician. With me is Dr. Steve Blatt, an infectious disease expert at TriHealth. And our topic of conversation today is the recently diagnosed coronavirus, the outbreak in China, and what things we should be watching for here as it possibly affects our health here in the United States. So Steve, obviously the first question, what is a coronavirus?
So there are lots of strains of coronaviruses. We do have coronaviruses in the United States, but they only cause a common cold syndrome. The coronavirus that has recently been identified in China seems to be a little bit more severe and is causing pneumonia in some patients. There were two other more severe coronaviruses, one called SARS, which stands for Severe Acute Respiratory Syndrome, and another one called MERS, Middle East Respiratory Syndrome, that were identified in the last 10 years. And those viruses were very severe and caused severe pneumonias and had a fairly high mortality rate. So far, this virus does not look to be as severe as SARS or MERS, but it's still a little bit unknown about how severe it's going to be.
Do we know what happens to a virus? Why? You mentioned coronavirus before as the common cold. What changes that virus all of a sudden to make it more likely to cause other diseases?
Yeah, so that's really unknown. So some of these viruses, even though they're in the same family, are more likely to get down in your lung and cause pneumonia, and other ones stay kind of up in the upper respiratory tract and just cause the common cold. It seems like some of these viruses are able to mutate and invade the lower lungs where they cause pneumonia, and those are the more severe viruses because they cause your oxygen levels to drop and people get a lot higher fever, and those are the people that get into trouble with severe coronavirus pneumonia.
Obviously, with international travel, it doesn't take a lot of imagination to understand how that virus can get to the United States. And it is relatively well contained right now. But let's just say, you're worried about that you had a potential exposure. What are the symptoms of a coronavirus?
So the usual symptoms at the beginning are fever, cough, maybe a little bit of shortness of breath. Some of the coronaviruses cause a lot of runny nose and maybe itchy, watery eyes. This one doesn't seem to do a lot of that. It's mostly cough and shortness of breath and fever are the main symptoms that people have. Sometimes muscle aches, feel excess fatigue. The full spectrum of the disease is still being evaluated, so we'll probably learn more in the next 1 to 2 weeks as more and more reports come in about this virus.
In my practice, I usually tell patients that we worry about someone who is underlying what we call immunosuppressed. They're not as strong. They have a disease that makes them a little weaker. They've had recurrent infections in the past. Are there any concerns that people should have about coronavirus if they're not otherwise healthy?
Well, I think so far the patients in China that have become most ill are generally older patients who have underlying medical conditions like heart disease, lung disease, diabetes. So anybody who may have complicated medical problems to begin with is probably going to be at somewhat higher risk of having a more difficult time handling this kind of coronavirus. But again, it's still early in the outbreak and we have a lot more to learn about it.
Any recommendations, Steve, of what we can do to protect ourselves from corona?
Well, I think the main thing is wash your hands thoroughly, especially when you're out in crowds or shaking hands or touching other people. And then certainly people who have been in China who have a respiratory illness probably should consider seeing their physician and getting checked out. Right now, the Centers for Disease Control is collecting specimens on patients who've been in Wuhan, China, where the outbreak started, and who develop a respiratory syndrome. If you're not ill, if you don't have a cough, fever, and shortness of breath, then there's no need to be evaluated or tested at this point. Most people who've been in China will be fine. It's just the rare person who could have come in contact with one of the patients who has this coronavirus that we might worry about.
What's your opinion of the regular patient wearing a face mask?
Yeah, at this point, there's probably no advantage of wearing a face mask out in public here because the disease is very rare here. I think you'd be much more appropriate to worry about regular flu here in the United States, which is spreading throughout the northern hemisphere, and particularly here in the United States. We've had a pretty bad flu outbreak so far this year with influenza B, and now we're starting to see influenza A. So whatever you would normally do to protect yourself from the flu, you should keep doing. Wash your hands, take care of yourself, bring plenty of fluids, those sorts of things.
I know I've been asked this question, I'm sure others have the same question in their minds, but the protection that we have here currently for the flu shot and using Tamiflu, does any of that work against the coronavirus?
Yeah, it turns out that the flu vaccine would not protect you against coronavirus at all, and so far it doesn't look like any of the anti-flu medications work for this coronavirus either. Now there is a coronavirus vaccine that's already being worked on for this strain of coronavirus. It's in very early stage testing. It's just being developed. They'll first do animal studies and then human studies. But Dr. Fauci at the National Institutes of Health, who's sort of the leading expert in vaccine production, said it'll be at least a year away before we have a coronavirus vaccine.
And I guess it's possible over that time frame the corona outbreak could become better contained and not even really be an issue at that point.
Yeah, I mean, chances are this will run its course way before the next year.
Right.
I mean, the way most of these coronaviruses have been controlled is the people who are ill are isolated, and then we do what's called contact tracing. So we'll monitor all the people that were exposed to the case. If they become ill, they will also go into isolation. And that is how we break the cycle of a coronavirus outbreak.
Obviously, as a primary care physician, I think the first line of evaluating this situation would be for if someone feels that they're ill or maybe they've had an exposure to come see their primary care physician. Any other recommendations you would have that a patient should do if they think they've been exposed or if they're not feeling well?
No, I mean, I think if you've been in China and you come down with a severe respiratory illness, it would be completely appropriate to call your primary care doctor's office so they know you're coming in. It might be reasonable to put a mask on before you walk in the office so you would protect any other patients who might be there. But then get evaluated by your primary care doctor. They can do some testing if necessary. We've already had some patients who were concerned they might be exposed, but they've all had the flu so far. Nobody has had the coronavirus.
So that mask would be appropriate then if you're really feeling that you're beginning to become ill. The cough, the fever, the shortness of breath. That's where the mask kind of
Right,
comes
the
in.
mask comes in to protect other people from you, not to protect you from other people.
Perfect, thank you.
Right.
Well, if you are feeling under the weather, if you're feeling sick, TriHealth has lots of primary care doctors in lots of locations. So feel free to reach out to TriHealth.com and we can certainly get you an appointment to see a primary care physician if you do not have one. We may be getting some questions from the audience, so sit tight and we'll see what we've got. Should people get the corona vaccine once it's available? Probably really hard to predict the future. As Dr. Blatt just said, we're not really sure what the state of corona infection may be a year from now. Lots of time to kind of figure that out as we go. But certainly if the vaccine is available and there is a lot of corona present either in this country and other parts of the world, I would assume that international travelers would be recommended to get that vaccine. Steve, what do you think?
Yeah, I agree. That's probably the group that would be most likely to benefit from that vaccine. If it turns out that the infection becomes more widespread, then maybe people with certain health conditions would be appropriate to get it here, but it's way too early to predict who should get that vaccine.
Super. Are there any precautions that pregnant women should take regarding this vaccine?
Well, I think regarding the illness, probably being cautious about travel to areas where the disease is known to be spreading would be appropriate. So far, it doesn't look like pregnant women are at any particular high risk. But again, it's very early in the outbreak, and many times pregnant women are at higher risk for getting respiratory illnesses like especially influenza. So it's recommended that all pregnant women get flu vaccine and that they be cautious during flu season to stay away from sick people. But again, we don't know enough about this particular coronavirus to know whether it would be a particular risk to pregnant women.
Super. Thanks, Steve. We're going to sit tight and see if a few more questions trickle in over the next couple minutes.
As I understand it, there are 5 cases in the United States that have been identified so far of the coronavirus, but they're all in isolation, and all of the people that have been exposed to those cases are being evaluated. So hopefully the outbreak will not reach epidemic proportions here.
Super. Are college campuses at risk for corona infection?
I think a lot depends on whether students from China are coming back to the college. If those students are ill, they should be evaluated at the student health center and either appropriately isolated, or if they have an alternate diagnosis like the flu, treated appropriately for that. So I think anywhere people are coming back from the area where the outbreak is most widespread right now in China, particularly around that area called Wuhan, there could be a higher risk of spread within those populations.
So if a person has traveled to China, they feel fine, they weren't in Wuhan, really not a big reason to worry.
No, those people don't have to worry at all.
If you were in China and you were in Wuhan but still feel totally fine, still not a real big reason to worry.
No reason to go see your doctor unless you become ill with a respiratory
So
illness.
it's in Wuhan and feeling badly, which kind of be the combination that would prompt you to recommend further evaluation.
Yep, absolutely.
Super. Looks like we have one more question coming in. Overall, is the news media playing this up? I personally don't think so. I mean, people are dying from this infection. I know as of this morning, they had up to 80 documented cases of the infection in China. So my take, both as a consumer and as a medical professional, is I don't think this is being overblown at all. Steve, what do you think?
Yeah, I think it's appropriate to be concerned about it, and we need to learn as much as we can about this virus. My personal belief is that this will probably be pretty easy to transmit. It looks like for every case that there have been about 2 or 3 new cases. So that means the numbers can double every 24 to 48 hours. But I think it's not going to be a real severe virus like MERS and SARS. I think it'll be, for most people, kind of like a really bad cold. A few patients will get really sick and end up in the intensive care unit, but most of the people will weather it just fine at home. Drink plenty of fluids, take care of yourself, keep your temperature down as best you can, and watch out for any complications.
Right. So the expectation really is if you're, for the most part, healthy, this should pretty much run its course over a period of several days.
Yep, exactly.
Super. Should any airports in the United States be avoided?
Well, the airports where we have direct flights coming in from China are monitoring people coming in with temperature evaluation. So if people have a fever and they're getting off the airplane from China, those people are immediately put into isolation and evaluated for this new coronavirus. I don't think you can really avoid any particular airports because if you're going somewhere, that may be the only way to get where you're going. So it tends to be the big international airports, so Los Angeles, Seattle, San Francisco, which have direct flights from China that are being monitored right now. And so far, it looks like it's working pretty well because most of the cases that have come into the U.S. have been identified through that mechanism. So.
Super. Dr. Blatt, thanks for your time. I really appreciate everything.
All right, thanks,
And again,
Steve,
for
I appreciate
TriHealth Table Talk, I'm Dr. Steve Cleves, primary care, and Dr. Steve Blatt, infectious disease. Thanks for joining us today.